Assalamu alaikum. Okay, let us continue with our lecture of spinal cord. Now we are going to discuss the ascending tract. As the name indicates, these are the tracts, those who are taking the signal upward, they are ascending with their signals and they are going to take their signals from the spinal cord to the higher centers. And they are going to pick up the information from outside the body, the exteroceptive, and from the inside of the body, the proprioceptive information. So let us discuss. By the end of this lecture, we should be able to describe the pathways for superficial and deep sensations and the effect of the lesions of these tracts in the section of the spinal cord. So there are we are going to discuss a few tracts. The two tracts that we are going to discuss in detail, these are the spinothalamic and dorsal column-medial lemniscus system. For these two tracts definitely, and for some other tracts, the basic organization is as follows. This particular picture is from Kaplan's neuroanatomy, USMLE notes. So let's see. The signal that is going to be perceived in the brain, you have to keep in mind two things about it. It will always start with the receptor. It will start with the receptor where the signal is received. It can be a free nerve ending or a specialized receptor like meconium corpuscles, and it will move up the central nervous system all the way when it reaches the brain of the opposite side. You can see this is the left side and it is going to reach the brain of the right side. So the signal starts from the receptor, it ends at the cerebral cortex, and it ends on the cerebral cortex that is on the opposite side of the receptor. It is contralateral to the receptor. So let's see how it happens. So the traveling of the signal from the receptor and the cortex, it is carried by three relays. Like in a rally race, the baton is carried by first racer, then the second one, and the third rev. Similarly, the signal is carried by three consecutive nerves. The first one is the first order neuron, second order, and third order neuron. So let's start with the first order neuron. The first order neuron is the one that is attached. This is a pseudo unipolar neuron. You must know that from the general anatomy lecture. And this receives the signal from the receptor through its peripheral process. Its cell body, its dorsal root ganglion, and this is present outside the central nervous system in the dorsal root ganglion, and this is a pseudo unipolar cell. And then the central process of this neuron, it enters the CNS and it terminates by synapsing with the second order neuron. And the key point to mention here is that this second order neuron, the synapse of second order neuron is ipsilateral to the receptor. The signal has not crossed the midline yet. So the first order neuron cell body was present outside in the dorsal root ganglion. Its peripheral process was acting as a receptor or receiving signal from the receptor. Its central process was entering the central nervous system and ending on the same side by synapsing with the second order neuron. Now, let's talk about the second order neuron. Second order neuron, it's a cell that is present on the ipsilateral side of the receptor. In some tracts it is in the spinal cord, in other it is present as up as the medulla oblongata. And this second order neuron, it always crosses the midline. As soon as the axon exits from the second order neuron, it crosses the midline, and after crossing it moves up. You will see there are tracts or lemniscus, we will discuss it shortly. It will move up and now on to the opposite side. It ends by synapsing with the third order neuron. And what is this third order neuron? It is usually a nucleus in the thalamus. In the case of signal coming from spinal cord, it is the ventro-posterolateral nucleus. You will see in the brainstem in the tracts that are coming in the brainstem, that is ventro-posteromedial, but here the ventro-posterolateral nucleus for all the signals that are coming from the spinal cord. So here is the third order neuron that ends. The third order neuron, it is the neuron of the thalamus, in this case ventro-posterolateral nucleus of the thalamus. Now it moves up, and the fibers that going up to the cerebral cortex are called projection fibers, and they will go up and they will terminate by synapsing with the post central gyrus. These are the part of the cerebral cortex that receives the signal. To be more specific, these are Brodmann's area 3, 1 and 2, but we will go deeper into that as we go on to study the cerebral cortex. So this is the general simplest organization. There are alterations as we move on to the more commonly known to the less commonly known tracts. There may be a difference in the number of neurons. Few tracts may have as 2 neurons and maybe more, and as the tract move up, the signal may not just be purely going to the cerebral cortex, and the signal may be exiting on the way to supply the reticular formation or other nuclei to perform their functions, or even they may be leaving as early as the entry point and taking part in the spinal reflexes. So there are collaterals throughout the way, but of course we'll try to make things simple. So this is the same information and against the picture that is in the neurosnell, because this is the book a large number of students follow. The same things are shown. I will quickly revise this. This is the receptor, and the receptor is signal is received by the peripheral process of the first order neuron. Here is the dorsal root ganglion. There is cell body present. The central process that enters, and then it ends by synapsing with the cell body of the second order neuron at the same site, and then it crosses the midline, immediately moves up in the form of a tract, and then it synapses with the third order neuron in the thalamus, in this case ventro-posterolateral nucleus, and then the fiber that is going up is the projection fiber until it reaches the cerebral cortex. So ascending tracts. So what are the different ascending tracts that are present and what are the functions of them? This piece of information is very crucial for you for the practical purpose and for your examination point of view. A lateral spinothalamic tract. This is a tract that receives and takes up the sensation of itch, sensation of pain, and sensation of heat and cold. Anterior spinothalamic tract. This tract carries the sensations of light touch, crude touch. This is the sensation that you get when you rub a piece of cotton on your skin. Touch and pressure. Let's say you press deeply on a tendon, that is the sense of pressure that is carried by anterior spinothalamic tract. Posterior white column. This is a little posterior white column, as we saw in the previous lecture, that it is the only tract. The dorsal column-medial lemniscus system is the only occupant of the posterior white column. So sometimes posterior white column is taken synonymous as the dorsal column-medial lemniscus system. So it carries a discriminative touch. Your ability to feel the texture, your ability to localize any touch that is happening, and 2-point discrimination. For example, there is so much of a surface area of the body, but you can immediately slap the part of the body where an insect is crawling, so you have very pinpoint localization sense. And when the insect is crawling on your neck, and especially when the more sensitive parts, especially on the face, you are able to feel its different legs, like it is walking on me. So there are 2-point discrimination. The whole insect is not received as a single blob, and you can feel this different. If something sits on your face, you feel out its legs and peculiarities, but if it lands on your back, you just feel a pressure, and that's why it's more irritating on your face. So that is the 2-point discrimination, that is more sensitive on the face as compared to the back. Proprioception, the conscious awareness of the positioning of the body, the tension of the body. If you close your eyes and you ask your friend to move your big toe up and down and not tell you, without looking at the toe, you can tell where my toe is at this particular moment. So that is your sense of proprioception, and there is vibration. Then there are tracks that are going to the cerebellum. the cerebellum, the tracts are taking them are anterior cerebellum, spinocerebellum, the posterior spinocerebellum, and cuniocerebellum. We will discuss them, but the point to get from that, these are the tracts that are carrying the proprioceptive signal to the cerebellum. So here is an interesting point that comes to mind. So if all these tracts are carrying proprioception and DCML also carries proprioception, so why the difference? So this is the proprioception that is going to the cerebellum and that is not under your conscious control, and you don't perceive that, you don't feel that, but it is constantly helping the cerebellum maintain your balance and coordination according to unconscious. So that is constantly helping you maintain the balance. And this proprioception, the same information from the same sources, it is going to cortex, cerebral cortex, and it is going to consciousness. You feel what you know what is happening. So this is the same information going to the cerebellum. It is automatically fine-tuning all your movement and positioning and everything, and the signal going to the cerebral cortex, it's going you a conscious awareness of what is happening. Means spinotactile tract, and these are the tracts that are going to colliculus and are responsible for the spino-visual reflexes. For example, something happened, touched here, you immediately turned your head to look that side, so that is spino-visual reflexes. We will look at that in further detail. Spino-reticular, they carry information from muscles, joints, skins, and go to the reticular formation, and they have a role in affecting the wakefulness of the person and the muscle tone when response comes through the spinal olivary tract. And this is one of another tract that is through the olivary nucleus. This is the tract that through the olivary nucleus it is taking the information to the cerebellum. So these are the different ascending tracts that we are going to discuss. So here is the anterolateral spinothalamic tract, and this is a picture from the Kaplan's neuroanatomy that we are going to discuss in detail. And here I encourage my students, those who are listening intently, that pick up a pen and pencil and draw as you listen to it, and it will help you clear a lot of concepts as you go along. And these tracks are one of the things that will not leave you as you go along at different stages of your medical life, and you will be constantly putting them in practice, inshallah. So let us start. Remember the basic rule. There are three order neurons. First one getting the signal from outside, ending on the same side. The second one crossing the midline, and the third one from the thalamus going up. So we will be following the same info. What sensation it is carrying? The anterolateral. You must have appreciated that I have joined these two, anterior and lateral spinothalamic tract, as anterolateral, because apart from a few differences, there and majorly behaving in the same way. We will see the differences. One difference that you've already seen is the sensation. Anterior one is carrying the crude touch and pressure. The later one carrying the itch, pain, and thermal. So let's join them here. So pain, temperature, crude touch, and pressure sensations are being carried by this. Interesting thing is about that the receptor, there is no an additional receptor. The receptor is actually the free nerve ending. That is the peripheral process of this first order neuron that actually receives this signal. This has its first order neuron, this cell body out here in the dorsal root ganglion. This cell, depending upon the pain, the type of pain it is carrying, it can be of a bigger diameter, that is A delta fiber. I'm not going to discuss the types of fibers right here. And this is the fiber that is responsible for carrying the fast pain, the sharp pain, the acute pain, like a pinprick that you feel immediately if you get it. And C type is the slow burning aching pain. After a pinprick, you will feel a dull pain in that area. That is the C. This is the fiber. So while we are on this topic, let's close these also. The fast pain is the one that is immediately felt when a pinprick is a very good example. It is felt in 1/10 of a second, and the signal travels as fast as 30 meters per second. It goes directly to the thalamus, and then it goes up to the cerebral cortex too, and you have very fine information about it, localization about its degree and all that. And the glutamate is the neurotransmitter that is most important. However, the slow pain is the one that you feel after a little gap. You must have felt that in a number of times. For example, if you hit your little pinky toe on a piece of furniture, you will not immediately feel a fast pain, but then gradually, like a volume, as the it will go like it will grow up like this, and you will feel increasing pain. And this is the slope and that gradually winds up, that goes up, and you cannot actually pinpoint. Like if you have a pinprick that goes deep, then you will say I will have a pain somewhere here in my palm. If you stub your toe, you will be pressing whole of your foot, not exactly the point of contact. So that is poorly localized, and it does not go directly to the thalamus. It goes into the neighboring areas, the reticular formations, and from different synapses it goes up. And as it goes into different synapses, the number of axons excited number on increasing. For example, the first one excites 3 axons, the next one, each one excites the further 2 1. So the signal, it multiplies, the signal grows big, and that is called winding up phenomena. So the pain intensifies, and you must have felt that after a deep pain, the pain does not start from the stable level. It starts from the low and it goes up, and that's the type of pain you feel in the like boils if you have, or something like that. And substance P is the neurotransmitter on that. Okay, let us move further. We talked about the free nerve endings that are the receptor here, and the pain sensation have little or to no adaptation. Okay, moving on with our signal, our track. We started with the sensation, the receptor was the free nerve ending, the peripheral process was carrying it, and we talked about its different diameters regarding the types of pains. The cell body was in the dorsal root ganglion, and then it enters the central process, it enters the spinal cord. After it enters the spinal cord, it does not immediately synapse with the second order neuron. It moves up or sometimes down. It moves a few segments before synapsing. So that part, so this part where the within the first order neuron, within the spinal cord, it changes its height, it changes its segment. So this is called track of Lissot. Track of Lissot, dorsolateral track of Lissot. So it is still the first order neuron. The first order neuron, it after reaching this, it is now going to synapse right here. It is going to synapse to the second order neuron. This second order neuron is the dorsal horn. It is present in the dorsal root. In most of the cases, it's substantia gelatinosa. If you are going to be discussing that, writing substantia gelatinosa as second order neuron, it's a very safe option. However, keep in mind that it's not exclusive. Other cells of the other cells of this interlateral spinothalamic tract, these other cells of the spinal cord are also involved as acting as a second order neuron. So substantia gelatinosa, although most prominent, but is not the exclusive second order neuron of the this tract. But let's keep this simple, and from now onwards, this is the second order neuron. So what was about the second order neuron? We remember that second order neuron always, the axon of the second order neuron always crosses. So it is shown right here. Immediately after exiting the second order neuron, it crosses the midline. It crosses the midline. Yes, here is another piece of information to differentiate between anterior and lateral column. The anterior one crosses, the lateral one crosses immediately within one or one segment of the spinal cord. However, like uh, somewhat like this, the anterior crosses like this, and the lateral one, sorry, the lateral one crosses like this. The lateral one, the anterior one crosses like this. The anterior one crosses more horizontally within the segment of the spinal cord, or the anterior one crosses more obliquely, and it is traversing multiple segments of the spinal cord before crossing to the opposite side. So it has crossed to the opposite side. So after crossing to the opposite side, it will run up in the anterior, in the white column. Which white column? We had posterior white column, lateral white column, and the anterior white column. So that depends upon the name of the tract again. So the anterior spinothalamic tract, the axons travel in the anterior white column. For the lateral spinothalamic tract, the signal will move up in the lateral white funiculus. So anterior white column and posterior white column. So you saw that the anterior white column white tract will move right here, anterior spinothalamic tract, and the posterior spinothalamic tract will move right here in the lateral white column. So we were here. So move on. Let's move on these fibers in the respectively in the anterior white column and the posterior white column. They will move up all the way from the spinal cord. It will continue to move up and continue to move up until they reach the brain stem, medulla oblongata, and before reaching the medulla oblongata and discuss that, here is an interesting piece of information that you can notice from this particular picture. This is the as the signal. This is the let's say lower part, sacral part of the spinal cord. As the new nerve enters, it enters at the medial aspect. As the next one enters, it enters at the medial aspect. As the next one enters, it enters at the medial aspect. So, what is this information important? At this part, if you see the cross, if you cut the spinal cord at this point, the most medial segments are the one from the cervical vertebra, and the most lateral one are the ones that are coming from the sacral vertebra. I have a better picture for this aspect here, right here. You can see I'll ignore all the other things and just focus on the this spinothalamic tract. The cervical segments are present most medially, and the outward sacral and lumbar segments are present most laterally. This is a picture from Snell's neuroanatomy. This is a picture from Gray's anatomy of at Gray's anatomy. So you can see the important piece of this information is that for any pathology that comes from outside, as it comes outside and it enters the cervical segment of the spinal cord, it will damage the signal coming from lower parts. However, any pathology that is coming from the inside, let's say a tumor or any syringomyelia, it crosses starting from that. It first it will affect the upper segment of the spinal cord. So that is the piece of information that I wanted to discuss before I move forward. So we have discussed that. Let's move on. So this is called the lamination. New fibers are added medially, and the pain ones are most anteriorly as compared to others. So it moves up, and as it is crossing the brainstem, the in the spinal cord, as you saw that the anterior spinothalamic tract was moving up separately from the lateral spinothalamic tract. As it reaches the brainstem, as it reaches the medulla oblongata, the anterior and lateral spinothalamic tract become together as a common bundle. And in addition to that, another track joins in. It joins the party. Another track joins this caravan. This is called spinotectal track. Spinotectal track. So these three tracks, the lateral spinothalamic tract, the anterior spinothalamic tract, and the spinotectal tract, they become a common track. They travel together, and this common traveling track is known as spinal lemniscus. As we move up, the spinal lemniscus move up until it reaches the thalamus. This thalamus that it enters the synapse, and with that, that is the third order neuron. And in the thalamus, this particular neuron is the ventro-posterolateral nucleus. So that is a third order neuron. A third order neuron, here a crude awareness and emotional reaction uh, to the pain may be generated. You will feel the pain here. You will not be able to localize it very fairly. You will not be able to identify its different degrees, but you will feel the pain nonetheless. Then from the third order neuron, the axon will move up and it will move to the cerebral cortex. So these are called thalamocortical fibers. As we go on and discuss the cerebral cortex, we will see that it moves up through the internal capsule. What is internal capsule? We will discuss it shortly in the next lectures, and it will move through the internal capsule and move to the corona radiata until it reaches the cortex. And here the brain relates this signal with the past experience, and you understand what that pain is, what that sensation is. You consciously appreciate that, you localize it, you grade, you differentiate its different grades. So I will remove myself from the background. You can have a picture here. So this is about the anterolateral tract, anterolateral spinothalamic tract. Let me go through a very quick review. Pain and temperature crude text was picked by the free nerve endings that were about the A delta or C type depending upon the fast and short pain. The cell body was present in the dorsal root ganglion. The nerves entered and they moved up through the through the tract of Lissor of one or two segments, and this synapse with a second order neuron present in mostly in the substantia gelatinous. The second order axons from that cells, they exit and cross the midline more obliquely in the anterior tract as compared to the lateral one, reaching the anterior or lateral white column depending upon the exact tract we are discussing. And it will move up to the spinal cord. As it is moving up, the coming axons, the coming second order neurons from the higher up areas are being added on the medial aspect. As it goes to the brainstem, the anterior, the lateral spinothalamic plus the spinotactal will travel together as spinal lemniscus until it reaches the thalamus and ventroposterior nucleus of the thalamus. That is the third order neuron, and their crude awareness and emotional reaction are present. And the third order neuron VPL, its axon moves up as the thalamocortical fibers. They will move through posterior limb of internal capsule, corona radiata, until it reaches primary somatosensory cortex, that is area number 3, 1 and 2. And here you will perceive based on your past experience, you will consciously appreciate it, and the different gradings will be appreciated here. So these are the pictures. I'm not going to discuss them. These are the pictures from Snell's neuroanatomy. I'm going to leave it from you. The same piece of information is shown here. The same three order neurons going all the way up. The only additional thing that is shown right here is these collaterals that are exiting and supplying the different parts of the brainstem, spine, and the cerebral cortex. So we discussed anterior spinothalamic tract. Okay, there are two or three differences that you need to know: the pain and the sensation that is being carried by lateral versus anterior, the crossing of the crossing over, more oblique in anterior, less oblique in lateral, moving up the spinal cord in lateral column versus anterior column. Apart from that, most of the aspect these tracks are like each other. While moving up, not all the fibers go all the way up and reach the cerebral cortex. Some of them, most of them, they reach the cerebral cortex and they relate to past experiences and conscious awareness and gradation. However, some of them go to the cingulate gyrus, that is a part of limbic system, and that helps to generate an emotional response. So you cry when you get a pain, and you become sad when you get a particular feeling that you had linked to your emotions. Insular gyrus gives the part that is, and it gives a response for the autonomic response, fight or flight, or shooting up of sympathetic system for a particular response and something like that. And the reticular formation, it activates the nervous system and it wakes you up and other things like that. Of course, this is touching the surface. You can go into as much detail as you want if you want to go into that subject. The pain control. As the pain moves up, the controlling the pain is a very interesting theory given in 1965, I think, by I'm not remembering the name. That is the gating theory. The gating theory is that the axons that are carrying the signal upward in the spinal cord, they can carry a fixed number of signals, and they are receiving signals from the pain. They are signals from the other modalities, other fibers coming into that. Let's say I prick my finger here, and the signal is going from a first order neuron, and it is going to in the spinal cord, relay in the next step and go up. But at the relay center, that relay center, it's also receiving, like, let's say, discriminative touch and other signals are carrying there. So what happens is that if I overwhelm that area, I'm let's say I'm rubbing my hand after it, I'm scratching it, the other non-painful stimulus, they will overwhelm the gate point, choke point, and that piece of information will try to go in and the pain will be blocked. And that is what we do naturally. If you get any sting of or any pain, we constantly start to scratch ourselves so that we will overflow our sensory stimulus, and that extra non-painful stimulus will close the gate. Otherwise, there is analgesia system, and there is periventricular gray area, aqueductal gray area, midline brainstem nuclei. They release substances like endorphins and caffeines and other opioid-like substances that go on, and in the circulation they will move down and they will influence the dorsal horn cells to relay the information. Similarly, there are tracts that are coming down and their tracts are ended in the cells of the posterior gray column, right reticulospinal, and they block the signal from moving further. So this is a screenshot for you that you can slow down and see. This is a picture from Kaplan's neuroanatomy. So here is a good mental exercise for you. Think of out of A, B and C and D, which lesion will call ipsilateral loss of pain and temperature and which lesion will call contralateral pain and temperature. We'll see. Any lesion in the brain, any lesion in the thalamus, any lesion in the brainstem, any lesion in the spinal cord, it will lead to the contralateral side pain and temperature because the signal coming from the receptor has already crossed the midline and has come up. You can pause the slide and see the notes, but here's the key home message. If the lesion is above the crossing, the loss will be contralateral. This injury will lead to the stopping of this signal because the signal coming from the same side, it will safely cross over and move up. The next, that is the dorsal column-medial lemniscus system. Okay, if you had understood the spinothalamic tract, this would be a little easy to go on as you are more in flow with the system. Dorsal column-medial lemniscus system. Let's start with the same. It carries the information of discriminative touch, like the texture you feel, like you will feel the quality of cloth between your fingers. Two-point discrimination and localization and vibration sense. All of these are being carried by this tract, and these are picked up by specialized receptors like Meissner's corpuscles, like Pacinian corpuscles, and these are they, each of them, they get a different sensation. Like some is good for vibration, some is good for two-point discrimination, and then this information from the receptors that is carried by the first order neuron, the peripheral process of the first order neuron, that is of class 2 or a beta type, and these are the cells that are entering the spinal cord. When they enter and their cell body is outside and they will enter the spinal cord. After enter the spinal cord, you will see most of the tract, it's not synapsing at this level, rather it will moving up and all the way up till it reaches the medulla oblongata, and there it will synapse with its second order neuron. Yes, it is moving up, but keep in mind that it is synapsing on the same side. That was our basic rule. Before we move up, let's say that as it enters, not all the fibers go, some collaterals and some fibers they exit from that and they enter in the nearby cells. They enter in the nearby cells for different reflexes. We will discuss reflexes in the next segment. And some fibers they exit at that and the internuncial neurons and the anterior horn cells, and they will mimic the reflex set, such as the cells that are going to take part in the spinal reflex, the myotactic reflex. So Coming on to the basics one, the major ones that are going up, and they will go up, and in the up as they're going, they are going to synapse, they are going up as a two bundles. The bundle that is carrying the signal from the lower limb, it is called fasciculus gracilis, and the bundle that is carrying signal from the upper limb, that is called fasciculus cuneatus. Let me go back one step back and discuss this again. As you can see, the from the lower limb it is entering, as the next signal is going, it is entering on the medial aspect, on the lateral aspect, my apologies. As it goes up, it will up on the most lateral, so the signal from the head and neck and upper limb will be most lateral, and the signal from the lower limb will be most medial. So this bundle that is carrying the signal from level T5 and above, on other words, it is carrying the signals from upper limb and thorax, that is called fasciculus cuneatus, and this bundle that is carrying signal from T6 and below, and that is called fasciculus gracilis. So fasciculus gracilis and fasciculus cuneatus, these are two parts of dorsal column. These are two parts of the dorsal column. Fasciculus gracilis is more medially placed. Fasciculus gracilis is more cuneatus is more laterally placed. And maybe in your books you might come across a term intermediolateral, intermediate posterior intermedial sulcus, intermediate sulcus, and intermediolateral or intermediate sulcus, that is the sulcus that is present between the posterior median sulcus and the posterolateral sulcus for the root, and that is called intermediate post intermediolateral sulcus, and that is defining the boundary between the fasciculus gracilis and cuneatus. Having discussed that, let us move up, and these first order neurons, these the fasciculus gracilis and cuneatus are the axons of the first order neuron. As they move up, they will synapse with the dorsal column system nuclei. These are the two nuclei by the same name. The fasciculus gracilis, these dorsal column nuclei, the fasciculus gracilis will end in the nucleus gracilis, and the fasciculus cuneatus will end in the nucleus cuneatus. So nucleus cuneatus, nucleus gracilis, and they are shown right here and here. So these are the second order neurons. So they have synapse here, and the second order neuron, what do? Just after their axon come, they cross the midline. They cross the midline, and they cross the midline, and these crossing fibers have the special name. This is called internal arcuate fibers. So what are internal arcuate fibers? These are second order neurons of the dorsal column medial lemniscus system that have, these are in the process of crossing the midline. It's not as simple as crossing from one side to other side, because the nuclei on the other side will also be giving fibers that are crossing the midline. So the two sides, they cross each other, so this is called sensory decussation, because the two tracks, they cross one another. This point is called sensory decussation. After crossing, the fibers will move up. The fibers will move up in the brainstem, and that going up fibers, these are called medial lemniscus. That has been labeled here as medial lemniscus, and in this picture here it is labeled as medial lemniscus. Medial lemniscus will move up of the brainstem. It will move through the brainstem medulla part, pons, midbrain, and will move up until it reaches the thalamus. This medial lemniscus, as it reaches the thalamus, it will end by synapsing with the third order neuron, the ventroposterolateral nucleus of the thalamus. That is the third order neuron, just like the track we discussed previously. And here the third order neuron will give rise to the fibers, that is the thalamocortical fiber, that will move up through the internal capsule and corona radiata until it reaches the primary somatosensory cortex, where all of these sensations are consciously perceived. So this is all about the dorsal column medial lemniscus system. Let me go through a very quick review. It started with the sensation of discriminated touch, two-point discrimination, localization vibration carried by special receptors. From the signal from the receptors was carried by first order neurons, peripheral process that was class 2 or A beta type fibers. Cell body was present in the outside dorsal root ganglion and it moves up through dorsal column in two parts from the T6 below, medially placed fasciculus gracilis, from T6 above fasciculus cuneatus, and it will move up. This will end on the same side by synapsing with the dorsal column nuclei, that is nucleus cuneatus and nucleus gracilis. The second order neuron they crosses the midline as internal arcuate fibers shown here and here in the sensory decussation. After crossing the same fiber will move up and they will called medial lemniscus, and medial lemniscus will move throughout the brainstem until it reaches the thalamus to synapse with the third order neuron ventroposterolateral nucleus of the thalamus. The third order neuron from here it will move give fibers that will move up the thalamocortical fiber through the internal capsule through the corona radiata until it reaches the primary somatosensory cortex. So this is about that, and here is the lamination of this tract shown. So the most medial fibers are those of the sacral fibers and most later one are those of the cervical fibers. The same picture is shown in the for the Gray's anatomy. So that's about it. If you have any question, please mention in the comment. Now this is a picture that is from the Snell's neuroanatomy showing the same items. First order neuron giving collateral for reflex shown right here, giving collateral for reflex, moving up all the way through spinal cord to the in here only fasciculus and nucleus gracilis has been shown. After that internal arcuate fibers will cross the midline, move up at medial lemniscus and through all the parts of the brainstem and until it reaches the thalamus where it synapses with the ventroposterolateral nucleus, and then thalamocortical fibers will go through internal capsule and corona radiata till it reaches the gyrus. Okay, one more thing that have not been discussed yet is this. Just keep in mind the name, we will discuss it very shortly. The cuneo-cerebellar tract. As all the signal move up through the fasciculus gracilis and cuneatus till it reaches the nucleus gracilis and cuneatus. From the nucleus cuneatus, some fibers they exit and go directly into the cerebellum of the same side. This tract is called cuneo-cerebellar tract, and these fibers from the cuneus nucleus cuneatus to the cerebellum, these are called external arcuate fibers. Just keep these figures in mind. We will discuss this in a little more detail as we go on to discuss the spinocerebellar tracts. Now again, this is a picture from Kaplan's neuroanatomy USMLE notes, and this is discussing the lesions. So if a lesion is at point A in the cerebral cortex, point B internal capsule, point C in the thalamus or brains and the thalamus in the upper part of brainstem 2, all of these lesions will lead to the loss of all these sensations on the contralateral aspect. Why? Because we are above the level of decussation. However, any lesion that is below the level of decussation, that is within the lowermost part of medulla oblongata or the spinal cord as shown in this point here, this will lead to the ipsilateral loss of pain and temperature as we are below the level of decussation, because the signal that was interrupted was coming from the same side. However, here the signal that was interrupted was coming is the right side, it was coming from the opposite side. So the lesion of the spinal cord in the tract in the spinal cord will lead to the ipsilateral loss of discriminative touch. So this is a table from the Snell's neuroanatomy, and you can pause the picture here and go through a summary of these slides. Moving on to the next tract, that is spinocerebellar tract. This is the tract that is carrying the signal of unconscious muscle and joint sense. the signal that is carrying the unconscious muscle and joint cell all the way to the cerebellum. You don't receive them very consciously. So let us start. One thing to remember is that as opposed to the cerebral cortex, the spinocerebellar tracts they end on the same sided cerebellum. If this is the right side and this is the left side, the signal coming from the left will end at the left. Keep that in mind as we discuss it further. First order neuron. First order neuron will be the same as we have discussed in the dorsal column-medial lemniscus system. It will have first order neuron will be the peripheral nerve cell who will receive signal from the receptor, that is muscle, spindle or the Golgi tendon organ or any other receptor, and the peripheral process will carry the signal. There will be dorsal root ganglion and it enters the spinal cord. Do you remember in the previous section we discussed that in the intermediate zone there were Clark's nuclei from T1 to L2. So those Clark's nuclei, these will be the second order neurons. The oncoming fiber, it will enter and it will synapse with that nucleus dorsalis, the thoracic dorsal nucleus or the Clark's nucleus, and it will synapse here. And after synapsing, the second order neuron, it will go out, move up in the lateral column as posterior spinocerebellar tract. It will move up as posterior spinocerebellar tract like here, and it will go up in the lateral column all the way to the medulla oblongata, and it will enter the spinal and it will enter the cerebellum through inferior cerebellar peduncles. The connections of the cerebellum with the brainstem are called cerebellar peduncle. For the midbrain there is superior, for the pons there is middle, and for the medulla oblongata there is inferior peduncle. So this is that. In the posterior column, you see here is a variation from the previous track that it only contains two order neurons. The first one carrying the signal from the receptor and the second one carrying from the Clark's nucleus, that is carrying the spinal cord, and it did not cross. The second order neuron in this case was Clark's nucleus, also called nucleus dorsalis, yeah, dorsal nucleus, remains on the same side, and it is mostly responsible for the individual muscle coordination and is the major tract as compared to the anterior spinocerebellar tract. So let us discuss the anterior spinocerebellar tract. So let me revise this tract. It started from the muscle joint movement, unconscious sensation, and synapsed with nucleus dorsalis that was present in T1 to L2 or CA to L3. Here any interesting phenomena comes into play, that the Clark's nucleus is present only till L2. So what about the proprioceptive signal that are coming from below? Let us the proprioceptive signal that is coming from S3. Those proprioceptive signals, they after entering the spinal cord through dorsal root, without synapsing, they move up in the dorsal column. They move up in the dorsal column until they reach L2, L3, L1, where they have to synapse with the Clark's nucleus. Then it leaves the white column, enters the gray matter and synapse with the Clark's nucleus. After that, it will move on through the posterior spinocerebellar tract and go up and supply to the cerebellum, the inferior cerebellar peduncle. Anterior spinocerebellar tract. Okay, it's a little interesting. It starts from the same receptors, the muscle spindle, the muscle all Golgi organs and so on. It enters through the dorsal root. The first order neuron story is same. Through the peripheral at the receptor, dorsal root ganglion, central anything. And most probably it does not synapse with the Clark's nucleus. They may or may not be synapsing with the Clark's nucleus. I have highlighted that, but uh, the newer editions they say that there are some other nuclei that are present there, and these are going to they are going for the synapses for the relay of this tract. So these are second order neurons. These are called the spinal border cells. These are spinal border cell. Newer evidence is pointing towards that. And no, the difference is that just as the second order neuron, after exiting, it crosses the midline. Majority goes to the opposite side. After crossing, it moves up. It moves up in the anterior white column, also in the lateral white column as anterior spinocerebellar tract. It goes all the way up and all the way up till midbrain, and in the midbrain, through the midbrain, it enters into the cerebellum through superior cerebellar peduncle. It enters into the cerebellum through superior cerebellar peduncle. And interesting thing that happens is that the fibers within the cerebellum they crosses again. So the signal that was starting from the side ultimately ended on the same side. So the signal is ultimately being received on the ipsilateral side, but it was due to double crossing. The second order neuron from the spinal border cells they cross the midline, then move up, enter the cerebellum, and then cross the midline again. So this is the double crossing that happens. So this is the tract that is responsible for the coordinated movements as a whole. The tract that will dominate is the posterior spinocerebellar tract, but these two are ones. So that is about the spinocerebellar tracts. You need to know that both of them are reaching the ultimately the same side. However, the both of them are reaching the same side, and posterior it remain on the same side. The anterior one it crosses it twice, once immediately at the level of entry and the second in the cerebellum. So there is a summary table from the Snell, and I wanted to talk about cuneo-cerebellar tract. The second order neuron in the posterior white column and the posterior spinocerebellar tract was the Clark's nucleus or nucleus dorsalis. It was present from T1 to L2 or C8 to T3, L3. So what about the signals that are entering the spinal cord above it? So what about the proprioceptive information from the deltoid that was entering from at the level of C5? Because as it enters the spinal cord, there will be no Clark's nucleus present in front of it. So here the cuneo-cerebellar tracts come into play. The cuneo-cerebellar tract, the signal of the discriminate touch, vibration, all the signals, it enters, it travels up with fasciculus cuneatus more specifically above in the dorsal column-medial lemniscus system and does not relay in the spinal cord right here and will move up and it will end and synapse in the nucleus cuneatus. Here, some books will say a few words, some books will say para, some books will say paracuneatus nucleus or accessory cuneatus nucleus. Why is this part different? Because the signals reaching this part, they will go through the posterior external arcuate fibers through the inferior cerebral peduncle to the cerebellum. So this particular nucleus, this paracuneatus nucleus, it's acting as nucleus dorsalis, the one that we say Clark's nucleus. So this is the cuneo-cerebellar tract, and that is how the unconscious proprioception from the upper limb reaches the cerebellum. Okay, cuneatus nucleus, posterior external arcuate fibers, and that. Okay, now we're going to discuss the other minor pathways that are not that much clinically important, mind you, in the examination only. But there might be functions. So let's start with the spinotactal pathway. This is a picture from neurosnell, and the spinotactal pathway is shown by the color red here. The spinotactal pathway, it carries the information for the spinovisual reflexes. It carries the information of pain, thermal, tactile sensations, and the first order neuron has the peripheral processes near the receptors, dorsal root ganglion, enters the spinal cord, and ends on the same side. The second order neurons that are synapsing with these axons are unknown, and otherwise they are present in the dorsal root. So after synapsing, the axons from the second order neurons they cross the midline. After crossing the midline, they travel up in the anterolateral wide column or and until they reach all the way up in the midbrain. In the midbrain, there is superior colliculus. It's a nucleus. It's a body that is responsible for the different reflexes in the brainstem, and thus this tract is responsible for the various reflexes, spino-visual reflexes. For example, if something hot touch your side, you immediately turns your head toward that side. So that is spino. You turn your eyes towards that side. More specifically, you turn your eye towards it in response to the signal from the spinal cord. Your eyes move. So that is the spinotactile reflex. Spinoreticular tract, shown by the same picture of the Snell's neuroanatomy, it carries information of different pain, touch, temperature, and the first order neurons had the similar sphere that was peripheral process, dorsal root ganglion entering the side, and it ends on the first order neuron, ends on the second order neuron on the dorsal root on the same side. Their name is not known, and there is various controversy between them, so not going into that. The second order neuron travel up without crossing. I will use the word mostly. Mostly without crossing, they will travel up, and after traveling up, they will go on. They will give different relays in the spinal cord and the brainstem too, and mixed with the lateral spinothalamic tract, they will move up all the way till the brainstem, and they give information in the reticular formation of medulla, pons, and midbrain. And one of the major function among the many other functions is the influence of the level of consciousness. You get a signal from outside, your brain gets more activated, you wake up. Spino-olivary tract. Spino-olivary tract is a tract that is ultimately sending the signal to the cerebellum. The first order neuron gets its peripheral process, gets signal from the receptors for proprioception, cutaneous information. Dorsal root is there, enters the spinal cord, ends on the unknown nuclei on the same side on the dorsal root. From those second order neurons, the axons, they cross the midline and they run up in the anterior and the lateral wide columns. And they, after going up, they will end by synapsing with the inferior olivary nucleus present in medulla oblongata. Then the third order neuron basically are the fibers or axons exiting from the olivary nucleus, and they will cross the midline again to reach the cerebellum. And see that golden rule is still applicable right here, that the signal from the cerebellum is received from the same sided receptors. So even if it crosses twice, the spinal olivary to be specific crossed only once from the receptor spinal cord to the olivary nucleus, but till reaching the cerebellum, the signal from the olivary nucleus to the cerebellum it crossed again. And last but not the least, there is visceral sensory tract, and these are the tract that the first order neuron carries the sensation of pain and stretch from the viscera, from the urinary system, digestive system, genital system. Enters the spinal cord, ends on the unknown nuclei on the same side. The second order neuron, it travel up, and the gray the columns, and they move up and they relay on the postulateral column of the thalamus until they reach the cerebral cortex. So that is about the ascending tracks. So I hope it was helpful for you. If you have any comments or suggestions or feedback, please let me know in the comments below. And after that, we will move on to the next section, that is the descending tracks of the spinal cord. Thank you so much. Allah Hafiz.